Ladies and gentlemen, it is 12:30, so it's perfect time actually for our next guest. We have a special luncheon addressed by a special someone. I will not reveal the person's name yet, but then I'll maybe make you guess who this person is. She is the current special advisor to the Prime Minister of Malaysia on public health, and began her mandate in April 2020. She is also a member of the government of Malaysia's Economic Action Council and is actively engaged in the COVID-19 response and recovery initiatives, both on the health, economic, and social front. Prior to this, she was the Under Secretary General for the Partnerships at the International Federation of Red Cross and Red Crescent Society, IFRC, in June 2016. And her portfolio is many: partnerships, research development, strategy, policy, knowledge. It seems like everything under the sun. And under her leadership in IFR, it developed a global innovation in many areas, including Futures and Foresights Unit, and pioneered the use of Islamic social finance to address humanitarian crises. Before joining the IFRC, she was probably very well known in Malaysia for being the founder of Mercy Malaysia, which she led from 1999 to 2009. And I actually read this book recently. It's an old book, but it talks about how this particular individual, our guest speaker, was actually shot. The sharpener from a bullet was lodged in her leg. This was in Iraq, if I'm not mistaken. And when that happened, she was actually tending to someone else because that other person was actually injured. And that bullet stayed in her leg until after she came back to Malaysia to have it removed. So this person is, not just a special guest, but I think like a superhero of some sorts, and ideal for many people, including myself. Just to give a little bit of background in terms of education, I think that's something worth mentioning, is that our speaker graduated as a Doctor of Medicine from the National University of Malaysia, has a Master's in Obstetrics and Gynecology from the same university, and is a Fellow of the Royal College of Obstetricians. I'm probably butchering what that means, and gynecologist in the kingdom. She is the one and only Tan Sri Dr. Jemilah Mahmood, who will be delivering a special keynote address on living in the new normal, challenges, risk, and responses. So I give it to Tan Sri Jemilah Mahmood to deliver her keynote address.
Thank you very much, Zaim, for your very kind introduction. And thank you to the organizers for inviting me to speak today. As I was deliberating what to say, and I see Tricia Yo is also in the hall, so I have to make sure that I don't repeat what I say at ideas. But I was trying to, let me preface by saying that this new normal that you often hear is not so new. And I particularly do not like the term new normal, because it seems that we have made up our mind what that new normal is. Rather, I would say that, we will move from one normal to another, to the next normal and the next. And 1 year now into this pandemic, so much of our previous revelations have become repetitive and routine. At any public space, it's almost muscle memory to take out our phones, scan the QR code, or check into My Sejahtera, and lean in to scan our body temperature. So remote working, that was once a debate, is now starting to look more doable by the day. So similarly, I think the aspects that COVID-19 has highlighted in our society, the social and economic inequalities, the need for rapid digitalization, and the unpreparedness of our global health systems have been robustly discussed at conference after conference. In fact, in a survey by Hay Consulting, most individuals working in Malaysia know how to get to a future-ready or future crisis scenario through digitalization, openness to change, and more development opportunities, but not sure if their organizations are ready. We may know all this, but because they have been laid bare at the same time, has been overwhelming. So where do we even begin? Simply put, it begins with individuals, businesses, and the government coming together. You would have seen yesterday that the Malaysia Airlines plane touched down at KLIA, and the reality of a rollout of our immunization plan has given us that hope that one day soon our streets will come alive again. our coffee shops and kopitiams filled with conversations, and our businesses thriving. It will be given to all Malaysian citizens or non-citizens residing in this country. But to see this happen requires the efforts of every person living in Malaysia. Vaccine nationalism cannot stand, and any remnants or attempts at fabricating it must end. It's a global crisis that can only be solved through global solidarity. It's a national crisis that can only be solved when everyone living in Malaysia comes together to solve it. Having said that, let me draw a couple of parallels between the needs of the immunization plan and the needs of businesses post-COVID. As we know, digital technology has been the backbone in keeping our economies alive throughout this crisis. From food deliveries and takeouts to the tools we use to communicate and collaborate with our work colleagues, despite remotely working. And both the government and businesses have had to rapidly adapt to the digital demands accelerated by this pandemic. In equitably and efficiently distributing the vaccine, technology will be the administrator to depend on. This is why Malaysia opted to focus on centralizing vaccine sign-ups and even follow-up appointments on MySejahtera. As people stay at home and therefore are more inclined towards digital media as a connecting platform, how the government communicates information and dispels misinformation, and this is absolutely critical about the vaccine, is also largely digital and also requires the assistance of every individual and organization alike. Perhaps the larger role for businesses and the private sector to play is in working with the government to develop the infrastructure to streamline large operations and manage big data. For example, shipment companies could share their logistics models to help the process of vaccine distribution and management, as done for COVID-19 lab testing. All this actually is ongoing, and there's been a robust dialogue and also partnership development with many private sector companies, learning from their experiences as well, implementing blockchain for tracking vaccines and so forth. So what should take center stage in this next normal now is actually us, it's people. As mentioned earlier, there's no place for vaccine nationalism in this global immunization strategy. Countering anti-vaccine myths requires the whole of society to work very hard. It begins with each and every one of us simply standing up for facts against rumors within their respective communities. But for this to happen, it requires an understanding of why we need an immunization plan. What does being vaccinated mean to our individual lives afterwards? For example, if you have a family member influenced by the fear-mongering sentiments rife on Facebook, it is down to you as a trusted person within that circle to engage. Though it may be easier said than done, but more often than not, we find it easier to trust people around us, people who are familiar to us. Sometimes a casual dialogue over some cup of tea is all you need. Similar to how the National Immunization Plan has the health security of the people at its heart, its success is dependent on people understanding its purpose. Businesses should also place stronger prioritization on the well-being of employees and building visibility of the organization's purpose. COVID-19 has disrupted the way we work, including our social and psychological coping mechanisms. If previously we used to work, including our social, we used to work from seeking the comfort and daily stresses through dining out or happy hours after work, now we are left with virtual calls like this that sometimes feel too familiar, and the incessant Zoom conference calls that we are all confronted with. But in overcoming the pandemic, businesses can play the role of building meaningful connections, keeping employees' motivation high, sustaining a healthy working culture. These points can be done by making clear the goals of the organization, support systems available, and trust between employers and employees throughout the pandemic. In fact, 94% of Malaysians believe seeing the purpose of the work that they do alongside being recognized or rewarded for their contributions, help to keep their motivations high. After all, the large time spent on work on the daily basis presents that opportunity to facilitate people's well-being and social connections in weathering this crisis. Ironically, this virus has asked us to keep our distance, but it's also been able to connect us more as humans as ever. And digitalization of our socialization demands us to put in more effort to connect to the ones we really care for. Facilitating a safe and successful immunization strategy requires us to build trust within our own circles in dispelling misinformation. Ensuring people's well-beings are well cared for requires us to have clear, strong, and purposeful support systems. In essence, the challenges that COVID-19 has imposed upon us is hardly new, and the ways that we used to operate pre-COVID was hardly normal. COVID-19 has not only shown us into this trajectory and that we're already headed towards, therefore it's best for that path and our next normal to be defined within the terms of security, inclusivity, and humanity. I want to just bring us back to where we started. COVID-19 did not happen in a vacuum. It happened because of rapid urbanization, rapid development, and destruction of our planetary health boundaries. As a result, we have made animals and wildlife closer to us, brought them closer to us, and zoonosis has become very rampant. We've seen all the warning signs. We had SARS, we had H1N1, we had MERS-CoV, and all the other viruses affecting us via animals. This morning, as I read the papers, Russia announced the first case of H5N8 avian flu. What I'm saying is that, not to create alarm, we're not facing another pandemic with avian flu, but we will be facing many more pandemics. It's not a question of if, it's a question of when. And it requires each and every one of us to dig deep and look into where we have not practiced good habits, where businesses have violated our planetary boundaries, and why the previous normal that we had is not a good normal to have. And we need to dig deep to look into the damage we've done on the planet that has led us to where we are today, and what reforms now need to take place, what innovations that we will leave behind, not just for this generation, but future generations to come. So it really, if I look at this 1 year experience, it has been extremely painful for many of us, but it's also been a real opportunity for us to really press that reset button and really rethink what development is suitable, what development is sustainable, and what does it mean to have a healthy planet and yet a thriving economy and a thriving society. So thank you very much, everyone.